Hello everyone, welcome to the VCME Family Medicine Residency Program. I'm the Program Director, Dr. Dar, and I just wanted to introduce the program to you and give you some highlights. So our program consists of 36 residents. Currently we actually have 37 residents, and we are a very thriving, happy program. Our residents come from all different parts of the country and the state, and we continue to improve our curriculum. We focus on several areas, and I would like to just give you a little bit of information on all of that. As far as our rotations and blocks are concerned, we have the typical blocks, but then in addition to that, we have very custom design and personalized training opportunities. As far as the regular blocks are concerned, in the first year, when you start the program, you'll be doing medicine, OB, inpatient peds, outpatient peds, night float, and then you'll be doing a few additional ambulatory rotations. And obviously, you will also be doing a ton of outpatient work, which means that you'll be seeing your own patients, you'll start building your own patient panel. And then for our medicine block, our residents do 2 months of inpatient medicine at Doctor's Medical Center, which is a wonderful place to practice. At the first year residents typically work with the second year and the third year resident. You will be on call every so often. Typically it's every third or every fourth day. Which means you will be taking admissions, you will be seeing patients. You will not need to stay overnight for being on call. People who stay overnight are residents who are on night float. So when you're on medicine rotation, when you're doing 2 months, you will be falling within the 30 hours rule, which means that you will not need to stay for longer than that time period. Whenever you are taking care of patients, you will be admitting your own patients right from the beginning, taking care of them on a daily basis. So we maintain a continuity of care. And then you will be signing out to your senior resident if you're off during that time. And every 4 weeks, you will have at least 4 days off, which means that you will not need to work those 4 days. They will not necessarily be consecutive. They will also not be necessarily one per week, but overall on average there will be 4 days when you'll be off. Whenever you are on medicine service, you will get a ton of opportunity to work with the attendings and also with medical students. So you can also become a part of the teaching process. It is a wonderful rotation where you get so much experience that by the time you're second year and then third year, you actually become as competent as any attending rounding on patients. You'll see a variety of patients, you'll see a variety of diagnoses, and of course there is always going to be tragedy, but then equally there's going to be a lot of fulfilling experiences. Our behavior health specialist faculty member does a lot of family conferences with residents where you will hone in your skills in terms of patient communication and communicating with the family, and also arranging coordination of care. So there is no shortage of experience in inpatient medicine rotation. For our outpatient rotations, especially for continuity of care clinic, our residents actually go to Paradise Medical Office, which is one of the community clinics. It is an FQHC lookalike, which some people may not even know too much about, but anyhow, this clinic site serves the underserved population and serves the needs of the community around it. It's been in practice for a very long time. Our residents provide excellent care to the patients. Actually, exclusively residents take care of the patients at this site. We have 36 residents. Actually, we have 37 residents, and they have multiple clinics throughout the year. Each and every resident is at the clinic at least once a week, or on average in a month 4 times a month. Whenever you are at the clinic, we try to make sure that you are seeing your own patients, but also we provide cross coverage. So at the clinic, we have 3 different types of teams with 3 different colors. So if you're not available to see your own patient because you are busy doing some other rotation, then your team member may be able to collaborate and may be able to help out. We also provide a ton of opportunities in terms of procedures, skills that are related to all areas of family medicine. so that by the time you graduate, you are competent and are able to do everything that any family medicine doctor needs to be able to do. We also have several unique opportunities in outpatient clinic, which are taking care of the LGBT community, taking care of HIV patients, taking care of patients who have hepatitis C, geriatric population, pediatric population, maternal health, women's health, family planning clinic, you name it, we have it. We have everything in our outpatient practice. We are really proud of it. Outpatient practice can be challenging because there are patients who are suffering from lots of different things in life, and taking care of them when we are truly being compassionate with the patients takes a toll on us. So we understand that, we realize that, and we make sure that we equip our residents with all those skill sets that are necessary to maintain their own well-being and also advance the care of the patients that they serve. For our OB rotation, our residents take care of patients in their throughout the scope of their reproductive years. So what we do is we make sure that they are taking care of patients' needs whenever they are family planning, whenever they are actually expecting a baby, and also of course then they follow their patients throughout their pregnancy. We try to make sure that you will be delivering your own patients, but if it doesn't happen, then one of your team members can do it. You will always have an attending to support you. We have lectures, great didactics on different topics of OB. We try to maintain at least about 40 deliveries per resident throughout their training period, and some residents actually choose to do even more. So there is a ton of variety, there is a ton of opportunity available. It's not required to do that much, but some residents actually do focus on this area. So the opportunity is always there. We also make sure that we partner with some community providers and OB specialists, so you actually go to high-risk OB clinics and take care of patients that have very special needs and are high risk. So by the time our residents graduate, they are very, very skilled to take care of obstetric needs and gynecological needs. So here in the Central Valley area, we have a ton of pediatric population. We just have wonderful children, and of course with that comes the healthcare needs. So our residency program trains residents in such a way that you will be so not only happy and joyous, but very confident and skilled to take care of the pediatric population. You'll be able to do, of course, the well-child checks, but also will be able to take care of all kinds of pediatric illnesses. We have a very, very rich inpatient pediatric experience or block where we have attendings available. We have a ton of newborn babies. We have a ton of illness, a ton of pathology, and then also we have pediatric specialties. So our residents rotate through outpatient peds clinics, but also do pediatric cardiology, peds neuro, peds endocrine, and all kinds of other specialty areas in pediatric health. We also make sure that the residents actually follow their own patients. So at least for 3 years, you can follow a newborn, and by the time you are leaving, the child is already walking and talking, and will be able to connect with you. We try to make sure that our pediatric emergency room visits are also met, and so you will be taking care of emergency needs of pediatric patients as well. You'll also have opportunity to do a lot of electives in urgent care area where you will do more peds. So we really take pride in our pediatric care. Many tools that we have is the point of care butterfly or point of care ultrasound, which is our butterfly ultrasound system. We have a few of these, so our residents can actually use the butterfly probe whenever they are taking care of patients in the hospital or in the clinic. We can do a ton of studies. We can do a lot of point of care images and studies to make sure that we are identifying and diagnosing appropriately. We have training systems available for this. We have a cloud system where we'll just be storing all kinds of images, and we are just very, very fortunate to have these, and we're very excited to offer it to all our trainees. As a program, we provide 6 months of electives throughout your 3 years of training. So there are about 25 plus electives to choose from. You can personalize your training, you can custom design your training, you can go outside the area for about 2 months, or you can do 2 electives outside the area, which is called elective away. So people can even travel outside the country if they choose to, and they get a ton of experience. We also have areas of concentration in, for example, addiction medicine, opioid dependence, lifestyle medicine, LGBT health. We have areas of concentration in women's health, and many different other things. There is a lot of faculty available willing to help, and more than willing to help, they're actually always excited to help and excited to be a part of the teaching process. There is no shortage of electives. In addition to all of that, we have regularly held sessions for Balance, where our residents come together as a group. We have regularly held sessions for retreats and different workshops where residents come together and do all kinds of training activities, so that by the time they are graduating, they are very skilled and very trained to do almost anything a family medicine doctor is supposed to do.